all. Welcome to another session of Stroke Support India. And today we are fortunate to have Professor Goswami with us, who's the Professor of Speech Pathology and Head of the Department at Speech Language Pathology, All India Institute of Speech and Hearing at Mysore, with more than 20 years of experience in speech disorders such as aphasia, neurocognitive communication disorders in adults and elderly. He has also been with ISHA for more than 12 years in the capacity of Honorary Editor, Secretary, Treasurer, and Joint Secretary, and has framed the document for scope of practice in audiology and speech language pathology in India in the year 2010. He has been awarded the Dr. N. Ratna Oration Award in the year 2020. And he was the first speech and hearing professional to receive the prestigious C.V. Raman Fellowship from UGC, Government of India, as visiting scholar at College of Applied Health Sciences, Department of Speech Hearing Science, University of Illinois at Urbana-Champaign, USA. So great, good to have you here, Professor Goswami. And Shruti will be moderating the conversation. I'll be amongst one of the participants. So over to you, Shruti ji and Dr. Goswami. Thank you.
Good evening, sir. It's an honor to have you here today amongst us. And we hope to get a lot of guidance and answers from you. So some information from our side. This is not just a stroke support group. Hardeep gives us equal opportunity for us to share our knowledge and to participate voluntarily in this group. We also have aphasia speech practice sessions going on. We all practice together. The caregivers and the aphasia affected. We have every week, we have weekly sessions. Every week on Thursdays, we meet 1.5 hours. So I prepare the material based on my knowledge. I search the internet and I also try to understand the needs of the people. Try to prepare a few slides and what they require. We also have a communication group where they post greeting messages. They try to talk and they try to post messages either by writing the messages or by speaking. So best efforts from our side too. And your guidance will definitely help us to move one more step forward. That is my feeling. Thank you and welcome you once again, sir.
Namaste. Thank you very much, ma'am, and thank you very much, sir. I'll just talk to you briefly what this term is and what we understand. So I'll just share my screen. My request to everyone that in case if you want to ask anything in between also, you can please ask me. There's nothing wrong. There's nothing formal. Okay, you can ask anything. Whatever I know, I'll try to share it with you people. Is that okay?
Yes, sure, sir. Thank you.
Yes, sir.
Can you see the slides?
Yes, I can. I Shruti can also.
Yeah. Can you see the slides, Shruti madam?
Yes, sir. Yes, sir.
Okay. So basically, I'm just going to talk to you about the path of recovery in persons with aphasia. That is how the family member views, okay, and what it goes around, how persons with aphasia, the family members, they perceive it. So with this, these are my contents. I'll just talk to you about, you would have heard about the term aphasia, like I'm sure all of you work as a support group. So you'd have heard about this term when, especially when the neurologist would have told, or speech language pathologist would have said. I'm just going to focus a little more on impact of aphasia, because this is one area which always I work. And then I'll just put a very briefly about paths of recovery. That paths of recovery, when I say what each one perceives it. And lastly, I'll just put a concluding remark. So for simplification, I have been always talking about, and I have been always saying, life is larger than aphasia. So yes, sometimes certain condition happens in our life. Okay, but that does not mean the life should stop. So always I say, this is the concept which we are trying to say, that once life is bigger than the aphasia or larger than aphasia. That means we are trying to emphasize on quality of life. We are looking from life satisfaction index. We wanted to view that when someone is having an aphasia, it's only one condition, but all his need, demand, want, his family support system, his vocation, all these are also there. That means when a person is having an aphasia, there is a possibility that some components will get affected, but everything is not lost. So when everything is not lost, person with aphasia has got will, support to stay, as well as to be the same father, the same mother, the same son, the same brother. That's what I'm trying to say. Life is larger than aphasia. It's only a condition. So if some of people who are affected are listening, yes, there are issues, but we can all sit together as a team, as a collective effort, we can look beyond aphasia. That's the one perspective. And what happens to a person with aphasia when we say someone is having an aphasia? So problem can be from different areas. Like in brain, we have got different lobes. We call it as compartmentalized. Similarly, whenever someone is having a brain damage, which can be due to a stroke, which can be due to road traffic accident, which can be due to infections, which can be due to diseases, metabolic disease. There are n number of causes we can talk. But I'm not going to focus on cause. Whatever has happened is happened. My focus is looking into what best way we can do. So when we see the aphasia, we can just say the person can have difficulty in understanding, he might have difficulty in reading, he might have difficulty in writing, speaking, going to vocation. There can be several issues. These are the broad terms which we put in. So basically, when you look at the definition, we say it is more of your expression can get affected, your comprehension can get affected. आदमी बोल नहीं सकता, समझ नहीं सकता, repeat नहीं कर सकता, नाम नहीं ले सकता. Though he knows he knows what is this, but cannot make. So these are the issues which can be there in persons with aphasias. So what is the consequence? Yes, once whatever brain attack, stroke, road traffic accident, whatever has happened with the brain is happened. Please understand that that's what I said, life is bigger than or larger than aphasia. Once whatever stroke has occurred, whatever brain damage has occurred, that will remain. Impact we can minimize it. But once it has happened, the consequence, what can happen? This may not be to everyone, and everything may not be lost in everyone, even in terms of speaking, reading, writing, naming. All skills may not be lost in everyone. Some things will be lost, some others. So consequence also there can be, because this occurs mainly in your adult population, elderly population, who have been the breadwinners. So what can happen? Consequences. I'm trying to talk about direct consequences. There can be a loss of self-esteem. A person might have been professor, doctor, businessman. But when the stroke occurs, and as a result of the stroke, aphasia occurs. Every stroke patient may not have an aphasia. So there can be loss of self-esteem. There can be impaired relation with family and friends. This is quite common. That relationship with the friends, with the family members, there can be a breakdown in the families also. There have been issues with that. Loss of independency. A person would have been very independent. He was doing everything, but now he or she might require some sort of support from the family member, the caregivers, from the society. Motor problems. We say might have problem in walking, writing, and the bigger problem can also come in terms of loss of job. There have been several individuals who lose his job. So this is one consequence with that. So it's not only the verbal mode which is affected. And I have been telling again and again that if a person's communication skills are retained, or if we can regain the communication skills or the verbal mode, the consequence of aphasia can be minimized. Why I'm trying to say is that, let us say a person can express that, yes, I can go back to work. He can say, yes, I want to go to the washroom. I want to do this. I'm hungry. So if the communication is good, the consequence can be minimized. That's what we are always trying to say. Person who is having language issues or communication issues, they have more consequences. The impact is more on that. Otherwise, when you compare to any other disabilities. There can also be certain other problems also. Like we always say, the person can have issues with financial dependency. Why I'm trying to say is financial dependency. Initially, they might have spent a lot of money, energy in the hospital, the bills. Plus, when there is a loss of job, there can be issues with finances. Marital issues can be there. There are several individuals who get stroke as young as 22, 23, 30 years. Marital conflicts can also come. Sexual incompetency also has been reported, but it is not always. But I'm just saying these can also be the issues. Difficulty in attending social gatherings. It's a, like previously they find it very hard to go to party, find hard to go to the park. Acceptance by self and family member. I repeat again that these are not always present in every patient. Acceptance by self and family, the self-esteem comes down. He doesn't feel that he's the same person. The family members. Inability to pursue hobbies. The person used to go to watch TV, cricket match, politics, whatever it is there. And there can also be certain individuals which can have other health conditions. Other health conditions, like let us say, because of the hypertension, he had a stroke. So there can be the blood pressure may not be under control, or he might have any other systematic disease, or there are some patients where I have seen is that they can go into depression also. So these are the other problems the person can have. Like I can just say that there are certain individuals when we go to a professional for help, they might say, I can understand. I always repeat one word that no one can understand anyone's problem. I know only there is a problem, but I cannot understand what goes in the mind, with the family, with the person. What is their consequence, what they are going on. No one can understand, because no one can understand someone's other's feelings. Yes, we know there can be issues. So that's what I'm trying to say. As a professional, I can only say these are consequences. But if I say I can understand your problem, I can understand your consequences, no. I know only these points. There are also certain individuals which I have personally seen. Why I'm trying to say is these are all those things which I'm talking about from my experience plus from my approach. There are also good number of people who might get abused. Abuse can be in terms of physical abuse, sexual abuse, caregivers neglect can also be there. Or there can be materialistic abuse. A lot of times, because of their stroke, someone might take their property, their money. There can be neglect. Neglect can be from the patient as well as from the caregivers. The reasons can be different. But what I'm trying to say is there are also good number of people who might be abused because these are vulnerable population. He or she will not be able to express who did what or may not be able to understand because there are different severities of aphasias. So there are possibilities of persons with aphasia being abused also. When all those things happens, these, when you look into the consequence, when you look into the abuse, all those things are nothing but these are affecting the overall activity and participation of the individual. I have put this slide where I have been trying to say that body function and structure, whatever has happened, like there is a lesion in the brain, whatever has happened is happened. Now our aim is to improve their activity and participation. That how we can make them person who can carry out different activities and how they can participate. Participate when I say in terms of what they like. It's not a forced choice, what they like, what they enjoy. And participation is a bigger term. But this activity and participation can also be influenced by what we always say is with the environmental and personal factors. Environmental factors such as the policies, the work environment, the physical environment, all are these environmental factors. Acceptance from the society, acceptance from the employers. And there can also be personal factors such as motivation of the individual, the accessibility of the services, availability of the services, affordability of the services. So all those are the factors. If these are environmental and personal factors are positive, it will have an impact on activity, which will in turn will have an individual on participation. Because countries like in India or in Asian countries, we do not have as good as the environmental factors, or even our healthcare system is not as good because several times we see a person who might have a stroke, he would not have been referred to a speech language pathologist as early. So we say within 72 hours, within 48 hours, if the services of speech language pathologists are availed, or within the first 1 month, they will have a good improvement. So that's what I'm trying to say, environmental factors, the accessibility, the affordability, the availability, the information which has not been conveyed. And as a result, we lose a lot of time and energy, and which can have a negative impact. So that in turn influences what we always say, that the activity and participation of the individuals. I can give you one simple example. Let us say there is a health condition of a person which can get affected due to what we call as the changeable or the non-changeable factors. Okay, so changeable factors can be which are in our hand. Let us say in terms of your age, in terms of hypertension, diabetes. Okay, these are or systematic diseases. These are changeable factors. If a person does good exercise, if he eats on time, his lifestyle, all those are in our hand. Non-changeable factors are your age, gender, race, which are not in our hand. So a person can control any one of the factors. And nowadays it is more of a lifestyle factors, and that's why we call them under non-communicable diseases. It can affect. And there can be several risk factors. Let us say there is one person who is having what we call as, who was a faculty. Okay, so if someone is having a faculty or someone is a teacher, his activity will get influenced, right? He will not be able to teach. He will not be able to go to school. When he is not able to go, okay, his communication will get affected, his physical, his academics, and he will not be able to participate in the school, in the classroom discussions. I'm just giving one simple example. So there can be several consequences which an individual can have. So what I'm trying to say is that it is a bigger perspective which we have. And when a person recovery from stroke, when we look into this, has got a stages which a person, every family undergoes. I have tried to put recovery from the stage of grief. Okay, so in stage of grief, what happens? These are the stages which every person undergoes or every family undergoes. So we see from denial, initially whenever a person is having, like soon after the stroke, all of us, all the families will go into a denial that no, he may not have a stroke until and unless you get a CT scan and confirmations. Then the anger comes that why it took the family as well as person. Then comes the bargaining. We always bargain that, okay, let us say I have a stroke, but I survived.
So just interrupting, have you changed the slide, sir? Or are we?
Yes, I have changed it, sir.
No, we are still on slide 9 at our end.
Okay, you can't see, sir. 1 second, sir. Then I will just 1 second. I'll again go back.
Yes.
Is this visible, sir, now? Is this visible, sir?
Yes.
Okay. So what happens in recovery when we look into, we always says that it moves from denial to acceptance. There are phases in that, which every family undergoes, every person undergoes. It may be easy for me to tell, but acceptance takes a lot of. So initially denial, the person may not, family, yes, we know there is, but until and unless stroke, a medical report comes, doctor says, patient is in ICU, there's a denial. The duration can vary from that. Anger, why to me? Bargaining, yes, I have made it, I have survived it. Depression. Then once a person does this bargaining, he or she, both the patient as well as the family members, undergo into depression. And finally, it comes under the acceptance. So I am trying to say, from a transient to permanent, from shock to turbulence, there's a lot of turbulence in the family, in the mind of the person, which we don't understand. Only the person who is affected, they understand, they know. And once the acceptance is come, then they seek the help that is both for physical well-being, mental well-being, and there we try to look into the activity and the participation. So acceptance of the problem, sometimes it can take a longer time also. And that's what most of the time, what my experience has shown is several individuals, like when they have a stroke, the consequences are not being told properly. The services are not being told properly. So as a result, several times the acceptance takes longer time. Until and unless we are not realistic that, look, these are the possible things which can happen. I have not told about certain other things, like they can have swallowing issues, there can be behavioral issues, there can be rigidity. All those are possible factors. And all those have got an impact on the overall well-being of an individual. Okay. So recovery from aphasia, when we look into, I have classified into 2 ways. I always look into the 2 ways perspective. One, I have been telling that the recovery is primarily from a medical point of view. So medical point of view, when I say, it is basically whenever someone is having a road traffic accident, stroke, or an infection, the emotions of the family and the person are very high. Because initial stages, survival is more important. That's why most of the families spend a lot of time, energy, economic, in terms of funds, lot of amount is being spent in terms of the survival, especially during the ICU. So the recovery from stroke, yes, the person has tried. So we have the highest emotions that they may survive, they may not survive. Yes, person who would have affected may not be knowing because he might have been semi-conscious or unconscious, but family member undergoes this. And then once he comes out, then the middle is from hospital to home. medical stable, life is out of danger. Once the medical condition is stable, life is out of danger. This is what practically what happens. Emotions of family and patient takes a backseat. Once a person survives, this emotions will come down that yes, the person has made it. Now, life is not at threat. I also wanted to tell one thing that at present, because of the advancement in the medical science, survival is not that difficult. Because of the advancement, there are good surgical facilities, good medicines, good neurologists who ensures that okay, individuals who are at risk do not have, means there is a minimum mortality. Survival rate is quite good because of the advancement. This is the primary stage. Secondary is once, then the worry starts, because the consequences once a patient has come from hospital to home, then the worry starts. Yes, somehow the finances would have been made, would have been managed. Both the medical cost in primary stage somehow would have been managed, and it is at a high peak. Then the other services like your speech language therapy, your physiotherapy, your occupational, or in case of psychology. So other worries now starts, because these are the things which will help a person to connect back to the society. Yes, because of the disconnections in the syndrome, the person has been disconnected from the society, from the job, from the family members. There can be different issues. So now the worry starts. So the order of recovery, what every family member views is initially is first is in terms of life. Once a person is having made the life, okay, when he has survived, then they looked into first thing which it comes into mind is what we called as overt disability. That is which is more visible. The visible is in terms of locomotor. That okay, once a person survives and he moves, the first thing which comes in the mind of every person is that okay, whether he can move, okay, whether he can move around, okay, that is the overt disability which will be there, because the locomotor is very obvious. In locomotor, then comes the communication. So we say first, can he walk? Then can he talk? Then we look into in terms of independence. Yes, he can walk, he can talk, and whether he is now independent in terms of activities like grooming, washroom, okay, eating. Then we say, okay, well, he is able to walk, he is able to talk, he can carry out independent things. And then we say, okay, now he can vocational, that okay, he can go back to work. And then we say in terms of psychosocial, connecting with the family, connecting with the friends. And then finally we say in terms of your personal factors, like me, I can do these things. And then finally it is the independent identity crisis. Final level is the identity. Yes, the person is same father, same mother, same thing what he or she was doing. So basically there can be several barriers and facilitators also, which always says we can always do a SWOT analysis or we can do a political. But all this depends upon that every patient has got certain strength, every family has got certain strength, every society has got certain strength. Same things holds good for weakness, same thing holds good for opportunity. But there are threats which are there from the environment factors, which can be a physical environment, which can be a mental environment, which can be a psychosocial environment, you name it. And also you can look into from political, social, and economical technology point of view. See, now over a period of time, since few years back, there has been little bit of political will, but still it's not that good. Now society is accepting a little bit. Economic, yes, persons with stroke survivors do not have a good economic support system, or what we call as the social security system. We can use technology like what we have been using it, but certain time technology also fails in some or the other perspectives. So typically how even a professionals, when we treat also, we say life, then physical, communication and emotional. This is how it moves. And that's what makes a person complete. Even when we are born also, we always have survived, then the person able to move, then talk, then emotions comes. And then whatever your economic, your professional, everything comes in. And that's how it has to be treated. So if someone says, I can treat this condition in few days, few months, I think that's not correct on the part of the professionals also. So always I say that recovery is not just from a condition. I repeat, it's not from a condition. It is basically connecting, communicating, coordinating, commuting back to work. From my perspective, I always say from bed to back to work, because that gives the identity to a person, that gives a self-esteem to a person, that gives a lot of dignity to the person. So until and unless, as a professional, as a caregiver, as a society, we don't, and I don't believe in treating the condition. I believe in connecting, communicating, coordinating, commuting back to work. That's how we have been trying to influence the policy maker, that the policies have to be looked from a bigger framework. It's not from a condition. It's the condition is only aphasia. With the aphasia, the family member, the person, the society, the economical, the emotional, everything takes back. And that's not so easy. And there is no medicine which can treat it. There is no surgery which can treat it. Because person is a person. So you would have seen these people. Why I have been put it up is that all these professionals, when you look into either the Abdul Kalamji or the Modis or the Shashi Tharoor or the Gavaskars, these are the people whose communication is too good. That's why they are more successful. And person with aphasias, because communication is affected, their self-esteem, their identity, their loss of vocation, everything takes a backseat. So establishing a good communication, and communication does not mean always a verbal. It can be non-verbal. And we believe communication can bring a lot of changes in the family dynamics. So good communication can bring a very happy environment at the house. So I'm trying to say, Chinese philosophy said a nap can make a person happy for an hour. Marriage can make a person happy for a month. A lottery can make him happy for years. But for life happiness, he has to find a way to make others happy. And that's what, as a caregiver, as a professional, we believe that we need to make happiness, that how well we can connect them, how well we can communicate with them, how well we can coordinate with them, so that the life, what they have survived, is not from life. It is from quality of life and life satisfaction index. We have been talking about life satisfaction index, how well satisfied you are now with this present index. So this is what I always say, that you might get very good people who might have good skills. You might get good knowledgeable people. You might get hardworking families, but it is the attitude of the person. It is the attitude of the family. It is the attitude of the professional. It is the attitude of the society which helps them to connect back to them. It's not one area. So if you have any doubts, clarifications, you can ask. I try to put less things, not too many things.
Thank you very much, sir. Very informative session, and we have all faced it. There are some caregivers and some persons with aphasia here. Whatever you said is true. We have gone through all that. And the last slide, what you said about the attitude. So let me tell you, sir, the participants here, they have this 100% attitude to be happy with themselves, to give the happiness back to their family, and the willpower to come back, to pick up and try to lead a best possible life, normal life. So that is there. And all the factors you said, definitely, yes, we have gone through all that. And now we have come to such a stage that we are at peace. Like we have come out of it, we are trying to lead a happy life and give a better quality of life to the affected. And we have seen that the affected are also taking very much positively, and they are trying to improve our quality of life as well. So I know the people in this group, so they are striving towards it. Thank you very much. I open the group for questions. Caregivers, any questions? Aditji, any questions from your side?
Yeah, can I ask?
Yes,
Please.
please go ahead.
Hi, sir. My name is Rohit. He is my father. So he was diagnosed with brain stroke in the last year June, and after the brain stroke, he was diagnosed with global aphasia. He's 60 years of age currently. As you said in your slide, the initial stage of recovery is very important for aphasia. So during that stage itself, unfortunately, we were ill-advised that a speech therapist is not required. Just a mirror therapy will do things, and we actually lost valuable time of approximately a month or so after his discharge. We did start with speech therapies, but in the last 1 year, we have not seen much of the progress. Of course, like from global aphasia, he has moved to Broca's, but still, he's still in the severe category. That's what I've been told by our speech therapist. There is a lot of sound errors. In fact, we tried very hard to find if there is a dedicated, speech and hearing institute in India where we can actually go and take him and get him assessed over there or keep him there for some time. We actually could not find it, and somehow, of course, through his stroke group only, I came to know that this is there. So, sir, I just want to ask, in my father's case, considering his age as well, like, what should we keep an expectation? What else should we do? And also, so just last one question, just to add, if you can guide us how All Institute of Speech and Hearing can help, if you can actually consult in OPD or IPD if it is there, so that we can look for better path of recovery.
Sir, from where are you, if you don't mind?
Sir, we are located in Pune, Maharashtra.
Okay, Pune से आप.
Yes.
तो घर में कौन सी भाषा बोलते हो आप?
Sir, Hindi.
Okay, ठीक है. क्या होता है कि जो रिकवरी जो है वो ना तो एज के ऊपर डिपेंड करती है, ना साइट ऑफ लीजन के ऊपर डिपेंड करती है, ना एजुकेशन के ऊपर डिपेंड करती है.
Yes, sir.
मतलब इनके जो फैक्टर्स हैं वो बहुत ही वेरिएबल है. कई बार क्या होता है, जो ग्लोबल से एनोमिक भी आ जाता है, ब्रोकास भी आ जाता है.
Okay.
पर वही तो इसमें ये, क्योंकि ये एक ऐसी चीज है जिसमें प्रिडिक्ट करना बहुत मुश्किल है, बहुत ही मुश्किल है, बट इंप्रूवमेंट होता है, ये मैं आपको बता सकता हूँ. कितना होता है, अगर कोई बोले कि 50%, 60%, आई थिंक दैट्स ए रॉन्ग स्टेटमेंट, बट वी शुड ट्राई इट, वी कैन ट्राई इट डेफिनेटली. तो फिर भी अगर आपको चाहिए कुछ हेल्प, एनी गाइडेंस, यू कैन get in touch with me. We can also help it out, but we can try, because now it's already 1 year plus, right? Last June mein hua tha.
Yes, sir. Yes.
Yeah, it's almost 1. So usually we say first 3 months में अच्छी recovery आती है, 6 months में phase कम होता है. Recovery तो होती है, पर क्या होती है, आपको recovery आप किस perspective में देखते हो, कि 0 से 1 आया, 1 से 2, right? So it's a very subjective. But if I assess him once, then I will know कि कई बार क्या होता है कि इसे ब्रोकास, पर ब्रोकास से भी बेटर भी हो सकता है.
Right, sir.
पर ये आपका जो जितना भी फैमिली सपोर्ट सिस्टम है, जो भी आप एक्टिविटी कर रहे हो, प्लीज कैरी ऑन. But continue with speech therapy, we can try strategies. But how much means I will not give a wrong statement to you, sir. It's very, very subjective, very, very person centered. कि जैसे आप कम बोल सकते हो, कोई ज्यादा भी बोल सकता है, और बहुत से वेरिएबल्स आ जाते हैं. कुछ पेशेंट होते हैं जो ग्लोबल से विद इन 1 month they recover well. Some don't recover. Means still that mystery we are not able to understand. क्योंकि आप सर्विस प्रोवाइड कर सकते हो, पर हम कह सकते हैं ठीक है, अभी मैंने जैसे बोला कि मोटिवेशन अच्छा है, सब कुछ अच्छा है, वो हमको लग रहा है, राइट? पर आपके मन के अंदर जो चल रहा है वो मुझे समझ में नहीं आता. That's what I'm saying. None of us can understand. None of us can be. Even I have been working since last 22 years, 23 years. I will not be able to understand what goes in. What I have told us, I have heard from their stories. So every person has got a story. But recovery हो जाता है कितना ये नहीं बता सकता.
Okay. सर वहाँ आईपीडी फैसिलिटीज भी होती है, अवेलेबल होती है क्या?
सर आई कुड सर मेरे को समझ में नहीं आया आपका क्वेश्चन.
सर वहाँ पे इन पेशेंट
नहीं सर आई हैव बीन डेड अगेंस्ट विद द इन पेशेंट.
ओके.
क्योंकि क्या होता है कि शॉर्ट टर्म के अंदर तो आप कर सकते हो, इट्स लाइफ लॉन्ग. इन पेशेंट जिस दिन आपने कर दिया, मींस आई हैव बीन अगेंस्ट विद दिस ओल्ड एज होम, नर्सिंग होम्स. इन पेशेंट क्या होता है कि पेशेंट जो है उसको एट द एंड ऑफ द डे उसका इन्वायरमेंट कौन सा है, क्योंकि कोई शॉर्टकट नहीं आता है कि मेडिसिन सर्जरी के अंदर ठीक है आपने दे दिया, इंप्रूव हो गया. अगर नॉर्मली भी आप करते हो कि एक बच्चे को जो टाइम लगता है वो अराउंड 5 years तक टाइम लग जाता है उसकी स्पीच आने में. If you think from that point of view, here also it takes time and energy both. So you should have patience, you should have perseverance. और ट्राई करते कितना सर, आई वुड नॉट. इनपेशेंट डेफिनेटली नो वन टेक्स. एंड इनपेशेंट के अंदर अगर 10 days 15 days में इंप्रूवमेंट, हाउ मच वी विल नॉट. दैट्स व्हाट टेल यू दैट इनपेशेंट कैन ओनली गिव लाइफ, नॉट क्वालिटी ऑफ लाइफ. क्वालिटी ऑफ लाइफ कम्स फ्रॉम द from the family, from the society.
Okay, yes.
Sorry, as you rightly said, it is we family members who play a very important role. So you talked about inpatient. I'm curious to know here. I have read about intensive aphasia therapy in certain countries where they stay for 15 days or 21 days therapy, and they talk about this therapy for long hours for 15-20 days. In fact, I had written a question about intensive aphasia therapy. So, how much do you think it will help? I have also seen some material saying that you can do this therapy at home. Sir, what is your suggestion about this intensive aphasia therapy?
Ma'am, intensive therapy means it is a regular therapy. It is a regular therapy for 45 minutes of session. Intensive does not mean that you do 3 times, 4 times, not that. Okay, intensive, when we say, it has to be a regular therapy, which can run into months, which can run into days. But 15 days, 20 days, when we work for a patient, because the intensive therapy, when you look into abroad, I have been telling, in abroad, within the 3 days, 2 days, we see the patient. In India, we see after 1 month, 2 months, 3 months. And there the intensive therapy is, say for example, in nursing homes, there are facilities. You can have under one roof, you need occupational therapy, you need physiotherapy, you need speech language. We have been also working for 3 to 4 hours. But again, we have to go individualistic. Please note, every person is different. Every person's strength are different. Every person's motivation is different. So we can't put all oranges and apples together. So intensive means regular. It's not per day you do 3 times. No, it's not that. It's not teaching a things. It's basically an acquisition, and every strategy is different. One technique which works best with one, it may not work at all with that.
Correct, sir. Correct. Yes, anybody else? So there is a common question in our group. What we all want to know collectively is this Broca's aphasia, there is right-sided weakness. The person is not able to hold the pen and write. But I have read somewhere that if the person is able to write, start writing with the left hand. For example, my husband is able to do so. He is able to write with the left hand. Spellings are not perfect, but we can understand the meaning. Is it that the speech will improve when the person starts writing? Anything like that, sir?
Ma'am, the problem with whenever person is having aphasia, that's what I always says, person with aphasias are very honest. Okay, it's a very honest condition. What they say, they will write that. Their reading, writing is also runs parallel. Okay, it's a left hand. When we use more of a compensatory approach.
Yes.
Okay, it may facilitate, it may not.
But one thing regarding this, sir, is it anywhere connected that the right hand motor function is improving? Along with that, even the speech improves, because there is a saying, when we go for a treatment, the people we meet, some people, they say, right hand, as and when the right hand improves, the person's speech also improves. Is there any correlation to that motor function and speech?
No, ma'am. There can be a person who has got good mobility but may not have. Because the areas which are required for the brain to communicate are very, very subtle. Very finer. But for your motor, you need gross things. That's why motor movements are faster. Okay. But mobility, when there is a motoric movement, because in the brain, in terms of verbal planning, programming is very finer. Yes, but when motor activity improves, why there is a relation is because his mobility is more, his ability to move in the society is more. So as a result, he gets more stimulation. That is a positive part. Like a person who is able to move, he can go to walk, he can go to park. Okay, he can move around. But a person who is not mobile, he will be only at one place. So the amount of stimulation what he gets from environment is less. That is the major relationship. So it's an environmental perspective.
Sir, I would like to carry forward Shruti's question. I had been suggested by someone that my husband, he had stroke 3 years back. That was in August 2019. And that was a left parieto-temporal lobe that was affected. So his right side, he has a right side weakness till date. So somebody suggested me that he should start using his left hand while doing small chores, like while brushing his teeth or something, he starts using crayon with his left hand. So that is going to improve his brain functions. Is there any correlation in that?
Ma'am, basically, whenever you carry out any activities, definitely there is some sort of stimulation in the brain. But if you see you use left hand, he will improve. Not like that. Yes, when we use left hand, what happens is when you do a motoric movement, it activates your right hand. Okay. But there is no 100% correlation. Basically, that's what I'm saying. We use a compensatory approach. So let us say we make sure that when he uses a left hand, he should be able to put his signature. Okay, he should be able to put his thumb so that in bank you don't have issues. He should be able to eat with the left hand. Okay, he should be able to hold. Because what happened, the paralysis, if it has not improved, so he can use that compensatory approach. There are good number of people who are able to do it, but not all.
So in his case, actually, he is able to use his right hand. He's able to write with his right hand as well. But then also, somebody suggested me that he should start using his left hand. That will activate his brain.
Don't do all those things, man. That's not, there is no scientific way. Because let him use, if he is able to use his right hand, let us make use of that. because there's nothing wrong with the left hand. We use only left hand when he's not able to use a right hand at all. That's a compensatory strategy, we call it as. But if he's able to use it his left hand, right hand properly, put signature, can write, read, don't do that. Don't force that. Don't do that. There's no what you call as literature, no studies with something. Yes, there are studies on the constraint-induced therapy which we use, but not for, it may not work. That's what I'm telling, it may not work with one, but don't force that. Let him use his right hand. What is the problem?
Thanks. Thank
Don't
you so
force
much.
that.
One more question, sir. I have. Can I carry on, Shrutiji?
Yeah, please do.
Sir, actually, it's been, as I told you, it's been 3 years down the line, and still there is some issues with his speech, some issues with his reading, issues with his writing as well. Well, these are the 3 things. Apart from that, I think he's leading more of a normal life. Anything which I can do right now, which can improve his situation?
Ma'am, I wanted to look at his level once. If I know his level, like say, for example, how good is his verbal output? Because I've been telling that your reading, writing closely resemble with the verbal output. Like how good is the speed, how good is the accuracy. Once we look into them, then we can look at, then we can, ma'am, everything has to be planned according to him. So if you tell me these are his needs, then we plan.
Okay, so can I connect with you, sir, personally someday?
Ma'am, you can connect. Yeah, ma'am, you can connect. Not a problem.
Thank you so very much.
I just wanted to have a look into it, that because once we do assess him, like we put him into a proper protocol, and then we know, okay, this is his gray areas, this is his white areas. So now when he said his reading, writing issues are there, if you think you can carry out routine, whatever you do, don't do. I don't want to do it into more of a mechanicalized. Yes, he should enjoy. Let us say he likes reading newspaper, let him read. If he likes watching movie, let him watch. If he likes writing something, let him do it. If he likes typing, let him do it. But we have to look into with what pace he is able to do it. But please understand one thing, this is my request to everyone, that 100% recovery is not possible. I always say that if I can hit 80%, I'm more than happy. My expectation is always 70 to 80%. Right, sir?
Okay, sir. Thank you so much, sir.
You can ask Mr. Chandrasekhar, no problem. I will be more than happy if you ask me.
Okay. Kelly? Sir, Kelly. Talk to him.
Talk to Guru.
Hi.
Yes.
Hi.
ಕನ್ನಡದಲ್ಲಿ ಮಾತಾಡಿ, ಏನು ತೊಂದರೆ ಆಗಲ್ಲ.
ಹೇಗಿದ್ದೀರಾ?
Hello.
ಚೆನ್ನಾಗಿದ್ದೀರಿ.
How are you?
I'm good. What's your name? ನಿಮ್ಮ ಹೆಸರು? ಗುರು. ಏನ್ ಕೆಲಸ ಮಾಡ್ತಾ ಇತ್ತು ನೀವು? ಸಾಫ್ಟ್ವೇರ್. ಇಲ್ಲಿ?
Partech.
Okay, Partech. Okay. ಇಲ್ಲಿ ಯಾವ ಕಡೆ ಓದಿದ್ದೀರಾ ನೀವು?
ಎಲ್ಲಿ ಓದಿದ್ದು?
Where did you study?
Sir?
BE na?
Where?
BE. Where? Manipal. Okay. He can do well. He can try with it. Sir, he is post 4 years. Best efforts, best willpower from his side. So, to be very honest, I am grateful to him for showing that kind of positive attitude. He is definitely a motivation and inspiration for others as well as me. But some amount of drooling is there. So this is what actually I wanted to ask you. Drooling, what happens is because of the weakness. Whenever there is a paralysis, now it is only a weakness. Okay, it's only a weakness. See, originality we will never get it. So what happens is drooling will be there when he is not paying attention to himself. When he carries out the activity, he gets engrossed in that. So that's what happens. Okay. So this mouth exercises,
Yeah,
what
we can
is
carry out, we have to carry out certain oral exercises also to strengthen.
oromotor exercises?
Yeah, oromotor, because there are a lot of people who have swallowing issues also. Amen.
Yes, Rekha, please continue.
No. Even I wanted to ask if this breathing exercises like pranayama and tongue strengthening the exercises will help speech.
Ma'am, there are no documents, but there are no adverse effects, but there are no documents.
Okay. Sir, one question from my side. Any oromotor evaluation is done after a stroke to find out what is, if there is any impediment to produce
Yes, we have to do, madam. Oh, no, ma'am, there are two things. See, this is not a peripheral lesion. This is a central lesion. So when you have a central lesion, the problem is with the center. That's why these are the peripheral issues. Once that improves, because your brain damage has got, because there is no activation in those areas. But recovery of this motoric is little faster. But definitely some residual deficit remains. It's not 100% recovery. If someone says 100% recovery, he is saying, he or she is saying wrong. There will be certain residual issues.
So what is this about auditory evaluation? Is it a must that the person is able to hear properly and then repeat what we are saying? For example, we do everyday repetition exercises. Is that person able to hear properly and then able to repeat, or is it a processing problem? So is it necessary to do any auditory evaluation for persons with aphasia?
Ma'am, it all depends. In case if we suspect there is a hearing issue, that is a different thing. Comprehension is different than hearing. But if the person is having a 60 years plus, and if we feel, then only we do. Not always. Not always.
Okay. Sir, I want some kind of guidance regarding diagnosis. A person is diagnosed with aphasia either at home or at hospital. What are the series of tests that should be performed with the person, either in hospital or with a therapist, or periodically, for example, after 1 year, 2 years? What are the tests performed? We have done Western aphasia battery test at NIMHANS for the purpose of getting disability certificate. But apart from that, so what are the tests that are required to help assess the person?
Ma'am, basically what we do is that's what telling it asks to all, what are the effect sites? First one, Western aphasia test battery, basically we do it to know what is the severity of aphasia, which domains are affected. And then in case if someone wanted a disability certification, for that purpose we do it. But then along with the aphasia, when we look into how good is his speech, okay, so we can look into, for instance, of dysarthric speech in terms of intelligibility of speech. But first we have to look for language. But usually, like, there is nothing called as such standard protocol, but usually we say every 3 months. Initially we repeat every 1 month, then after 3 months, then we put into that how variety is there. So it is case to case, but definitely one has to undergo for repetition of test minimum once in 6 months after 1.5 years of school. 3 months is an ideal.
Yeah, sorry for interrupting. Sir, where are these tests available? Is it in every city, or can we come down to Mysore?
Yeah, ma'am, you can come back. We can do online also. That's not a big deal. So we can do test.
Okay.
That's not a problem.
Okay. So, okay.
But
so
again, it depends upon what are you looking from this test. Because the clinician, depending upon the patient, we can decide. It's not that all you have to do. That's what I'm trying to say. It's unlike a medical. These are not, everything has to be customized based upon the person.
Yes.
I cannot fix it everything on everyone. That it has to be customized. Like, say, for example, so many times we look into quality of life. We also look into how satisfied they are. Emotional issues. That also, once we see a patient, we know, okay, like today everyone might look happy. But when we see a patient, there can be issues. Like
Correct, sir.
I have gone to several times in the court cases and all. When they come in the clinics, they are fine. But then they say there are family conflicts. Someone has applied for a divorce. Someone has been abused. Someone has been abused from a materialistic point of view. So many times they will ask, sign a signature, or they have taken the PIN number. So there are issues.
Yes, correct, sir. Sir, this is there are two questions with respect to All India Institute of Speech and Hearing. One is, how do we contact you?
Ma'am,
How do
anytime
we
you
take
can
an
contact
appointment?
either. I have sent a mail. My number, you can contact us, ma'am. That's not a problem.
Okay.
Anytime, in case we work from 9 to 5:30, everyone can walk.
So what are the contact details is in the website?
Yeah, it's
we
available
can-
on the website. Yeah, it's available. But you can walk in from Monday to Friday. We are working, but we always prefer that my OPDs are usually on Wednesdays. But Monday to Friday, anytime you can work. But usually we prefer 9 o'clock.
Okay, sir. So second thing, when I was going through the website, I saw a lot of projects with respect to aphasia, some completed, some ongoing. My personal request on part of our group, so any vacancies or candidates required for these tests that these clinical trials or anything you're performing, so please bear our group in mind.
Yeah.
We will be very
Yeah,
eager
like-
to participate, sir. So it's
Yeah,
a
some of
personal
my
request.
PhD candidates we are looking into from a better perspective. We will contact them.
Yes, sir.
Like I
Yes.
have done, like whatever I talked about recoveries, these are the stories of recovery from persons with aphasia. It is from their mouths. So that's how we have it.
Yes, yes, sir. We have some very enthusiastic participants like Mr. Chandrasekhar here and Mr. Gururaj here, and very loving caregivers also, like Mrs. Rekha is here today, and Mr.
Yeah, ma'am, it's
Kumar
all,
Pals.
ma'am, it's all a collective work. It's not
Yes,
one
sir.
person.
Yes, sir. So I mean to say that we will support our family members. Anyway, vacancies
Yeah,
or anything,
yeah,
please write to Mr.
anything, yeah,
Hardip.
definitely.
We will be more than interested to participate and in fact give the best participation from our end. That is one thing. And one more thing, sir. I saw some, for example, the speech language pathology facilities available, the articulograph lab, and the language pathology lab. Sir, how can we, are we eligible to make use of those facilities? I mean to say persons with
No,
aphasia
ma'am,
for
those are
any
research
test?
labs. Basically,
Okay. Okay.
they're not working for everything. These are for different
Okay, sir.
conditions.
Okay. Okay. Sir, your recommendation for any books for aphasia that we have to go through?
Ma'am,
for any
that's
kids?
what I'm trying to say. I think you have done too much of what you called as Professor Google, right? I would
Basically
always
through
say-
your website,
Yeah,
sir.
I would
Basically
always
through your
say-
website.
I would always say that look from a person point of view. See, books and all, what happens is I don't want them to be a mechanical. Okay. How much we could get, we would get it. But it has to come from a very natural process.
Yes.
I don't want them to be into that structured mode. That's what I've been working on. It's a semi-structured, unstructured mode. Because the moment I put a person for a therapy, I should look from what he can do. And how can I get back to him work? Like I have people who have been a teacher also, who have been a doctor also, able to go back, but not 100%. But some people are doing more than 100% also. Like there have been people who is like a doctor also. So they are able to do it. But some can do, some cannot do. That's what I'm trying to say. But there's nothing called as a book and all. But if you wanted to think, I would always go that if you can write book about them, that what you feel, what you did, that will help the society. And that's what when you look into disability certificate, because we have fought a lot with that for disability certificate. I was a part of that group for framing the certification. So we have fought a lot with that. That's how it has come by.
Sir, in your knowledge, have any persons with aphasia made use of the provisions of the government, this disability certificate, and they have tried to get back into their jobs?
Yes, there are several, madam. I am telling you, there has been one teacher, one doctor, one judge, one driver. Yes, sometimes we change their work. So I always tell them to get back. Who have gone back to studies. So it's not that it is little hard, but we have to fight with that system.
Yes, yes, sir, I understand.
And lot of people who had got, I can share, like there was one young couple around 25, 26 years. So they had apprehensions whether they can conceive. I said there's nothing wrong. And now they have a boy baby of around 5 years. So all those are myths.
Yes, yes. Thank you so much, sir. Any questions, Hardeep ji? We are at 8:40. We have had a great session. I would like Hardeep ji to come in now. He will definitely be having some queries with his expertise.
Sure.
Yeah.
If Chandrasekhar ji has something to ask, Mirekha ji maybe. Otherwise, I have some queries. Anything that you want to ask or add in?
No, sir. I will connect with him personally because I have a few personal questions about Chandra. So I will connect with him personally.
Yeah, please,
sir. Thank you.
Please. Well, I think it's been interesting. Thank you very much, Dr. Goswami. As you rightly said, this is a very complex issues. Financial issues come in. Family issues, societal issues come in, and of course, we see that in our group also, and I'm sure you would have seen many of them over the years as to how things evolve. I was just, one thing caught me that you are seeing patients, you mentioned somewhere after maybe 1 month or so, that you get the chance to see a patient again. Is that the kind of pressure? I mean, are there so many people and so less of, let's say, SLPs? What is the average, let's say, time span that you are having?
Sir, I could not get it. Span means time, sir. How much time?
What I'm saying is that you mentioned somewhere that you get to see a patient again only after about a month or 15.
Yes, sir. Yes, sir. Sir, that's basically the problem is coming with the medical fraternity. Referral. That's what I was trying to tell, that whenever a person is having a stroke, the most of the hospitals, they do not have these facilities. So most of the time, I have been telling that they look from survival. Okay. Once the survival is there, they say, okay, done. And then several times I have been also talking to several conferences and trying to tell them that please make sure that the person is referred. Then we can take the family into confidence. See, if the family is being told from day one that, look, these are the issues which can happen. Because soon after the stroke, once he's coming from ICU, they don't tell what are the consequences.
Okay.
The person, they have not been, in India, I have been talking about, because we do not have that strong team approach. Healthcare system still is a broken. And most of the time, maybe my word may not be wrong, but what happens is medical fraternity has to take a little pro, and it's not a medical problem anymore. Once a person is survived. Blood pressure is controlled, the vital functions are starting functioning, then he's fit. But then he needs the support system. So I think there need to be looked from the, I have been talking about certain people, but of late, still we need to do a little more work with the medical fraternity, that they should do appropriate referral at an appropriate time. Then things can be little better. Earlier we do it, better it is. Because that time motivation is very high. But after 1 year, 2 year, motivation itself comes down. First 6 months, the main reason what we're saying, the motivation of the family, the expectations are very good, but they do it very well. Like in abroad and all, within 3 days, the therapy starts. But here, after 3 months, when you go after second or third referral, then they'll say, oh, let us look into that. You would have lost certain time. That golden time is very important.
So are you seeing now, for example, at least in major hospitals, that speech language pathologists are also part of the team? Is it?
Yes, sir. There are major hospitals. There are people, sir. There are professionals which are available. But then to again, sir, everyone does not work in aphasia.
Correct.
That is also one thing. And everyone cannot, like, may not be good in that.
And are you seeing, for example, or are you seeing some prospects of, tele-rehab?
Sir, we work on tele-rehab. I have worked extensively on tele-rehab.
Sorry?
I have extensively worked in tele-rehab.
Okay.
I have extensively worked. I wish I could have told today him to come down. So yes, I have been seeing most of tele-rehab works, but not with everyone. I am just trying to say, but we work. Once we know if this patient is able to cooperate and able to deliver it, we can do it.
Okay.
Definitely it makes a difference. Because wherever people are not there, definitely we are in touch with them.
And are you seeing growing interest in SLP as a career? Are you seeing more and more people joining the speech language pathology as a career option? Are you seeing that?
Yes, sir. There are good number of people. Because sir, actually, if you look into the healthcare system, each one of us is at risk of having one or the other non-communicable disease. So some people at last laugh at me that why do you work? I said I may also be a patient someday. So each one of us is at a risk.
So as if the tele-rehab, that facility that you talked about, how does one get to avail that?
Sir, you can just send an email to me, sir. We can connect it because there are several people who work in tele-rehab. If in case anyone needs, we can provide services.
Okay. Yes.
So that's what I'm telling. We have cut down a lot of cost, lot of time, energy. We can see it.
Right. Because as you can see, at least most here are equipped with at least the basic.
Yes. Like, for example, now people who are good, definitely tele-rehab can work with that.
Right. Also, sir, I remember maybe we discussed that a long time ago. Are you or having maybe some students or maybe some people within your fraternity who can perhaps occasionally come on groups such as ourselves or guide us as to?
Sir, anytime you can tell us, sir.
Okay.
You tell me whenever you want any guidance, any help. Don't worry. I am available.
Fine. That would be great. So that is all.
And anyone who is having issues with disability certification, issues with the workplace, please let me know.
Right. Yes.
Please let me know whatever issues are there. We can sort it out.
Yeah. Thank you very much. I think over to you, Shruti. Thanks a lot, Goswami.
Thank you, sir.
It's been a great encouragement, and I'm sure all here will be coming back to you, and we'll take it from there.
Yes, sir. Anything, any help.
Yeah. Over to you, Shruti.
Okay. Sir, here our group members are very much interested in the tele-rehab services. Sir, do we write a mail personally to the department?
Or you can send a mail. My number will be there. You just send a mail, text to me. You let me.
Okay. So,
I can arrange certain things.
Okay.
Because I work exclusively in that area.
Okay. Sir, to the department number, which is in the website?
I will. You can just leave a text to me on WhatsApp number of this. Which, sir, I think would have given.
I will share the number of Dr. Goswami on the group.
Yeah.
As he says,
you can. This is my number.
WhatsApp to him. Yeah. Shruti, would you like to close the meeting? Then.
Yeah. Please note down Dr. Goswami's number. Thank you, sir. Thank you for your very precious time, and you have made alternate arrangements for us, and also more thanks for the guidance regarding the tele-rehab services and definitely a lot of people will reach out to you. Definitely, we are all looking forward to more support from and guidance from you.
Sure.
On behalf of our group, thank you very much, sir.
Thank you, and thank you.
Thank you.
Thank
Bye.
you, Hardeep
Have a
ji.
nice day. Good
And
night.
thank you. Thank you.
Thank you. Thank you, sir.
Bye.
All the best
Thank you,
then.
sir.
And I'm closing the meeting now.